Talk to me about what you've heard today in the news that broke with COVID and the president.
Well, I'm very encouraged. He is asymptomatic, and the odds are in his favor of a full recovery without symptoms even. And there are things that can be done to ensure that he will not have symptoms. And if he gets symptoms, there are some early therapies that are effective. And so I'm quite confident that that he's going to show everyone that just because you have a positive test, it doesn't mean that you're going to have a disease state, and that it's not a death sentence just because you have a positive test. 50% of the people who get COVID will have no symptoms and recover entirely without treatment. And many of them will never know that they had COVID. And we know that 92% of children will have no symptoms or mild symptoms. So that's the facts, and we got to look at the facts.
What do you think the treatment is right now for the president? Because we saw Chief of Staff, White House Chief of Staff Mark Meadows come out. He didn't comment on any treatment at this time. We imagine a statement will be put out at a later time. But with the president showing mild symptoms, would he be treated at all in the White House right now?
I think evidence proves that early treatment does matter. The strategy that's been used in the United States and China and most of Europe has been a failed strategy when you compare it to Taiwan, where there's 24 million citizens and only 7 have died during the whole 9-month pandemic. Or look at Japan, 121 million population, and less than 1,000 have died during this whole pandemic. And they're using early therapies. And one of the tools that they're using is inhaled corticosteroids, a very safe, cost-effective, readily available treatment. And so if someone has symptoms, that will block the release of the inflammatory chemicals, the cytokines that actually are the killers.
I want to ask you about President Trump here, talking about, you've heard the president talk about the treatment as we were talking about this hydroxychloroquine. I want to play this for you, and then we'll talk about it.
I happen to be taking it. Hydroxychloroquine? I'm taking it, hydroxychloroquine.
When?
Right now, yeah. A couple of weeks ago, I started taking it. Because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right. I'm not going to get hurt by it.
The president there on May 18th talking about taking hydroxychloroquine as a prophylactic. Doctor, have we learned more about this specific drug moving forward? Would this be something advised perhaps later on if he shows heavier symptoms?
It's one of the tools that's available. What I'm offering is non-controversial. There's been a great deal of controversy with hydroxychloroquine, and most of it's unfounded. But what I'm talking about is an inhaled steroid called budesonide, and we've treated over 1,000 patients just in West Texas, and none of my patients have died, a 0 fatality rate, very safe. And so this is another tool, a very powerful tool that could be used to help the president.
Let me ask you, I don't mean to cut you off, but I do want to know, do you think that could be helping him? He stated he took it in May as a prophylactic, hydroxychloroquine. Would that help him in his battle today? Is that already out of his system?
No, it stays in the system for a while, and we've known about that medicine for 65 years, and people don't have to take it daily for it to stay in their system. And it does have a prophylactic. I think there's a lot of evidence that it has a great effect prophylactically and in early treatment.
That's interesting. We'll continue to monitor that, of course. As you mentioned, yes, it's been very controversial. Talk to me about quarantine. The president is quarantining at the White House. First Lady also quarantining as well. We've known, I believe, a few that have come into contact with him just to be sure. How long is the quarantine process for him?
That's a moving target. If you look at the CDC and the health departments, it's been 14 days, it's been 10 days. And really it comes down to, is the patient contagious? And so if they're being treated with something that's suppressing the multiplication of the virus or decreasing their ability to spread the virus, and they test negative 2 consecutive tests and they're symptom-free, then I believe it's appropriate to have a shorter quarantine period.
Well, he's got a lot on his plate. He's still continuing to work. Mark Meadows confirmed that. I appreciate you coming on this, Dr. Richard Bartlett. Thank you for your time.
Thank you.
We are just getting